This video is for those of you who have a deep, nagging butt pain that might cause some numbness, tingling down the back of the thigh. Hey guys, Dr. Wong here with Next Level Physiotherapy, and today I'm going to talk all about piriformis syndrome. The piriformis muscle is located under the butt muscle and sits on top of the sciatic nerve. So when the muscle is pressing on the nerve, it can irritate the nerve and cause numbness and tingling down the back of your thighs. The common cause of piriformis syndrome includes compensation from weak muscles around that area. You can also develop piriformis syndrome if you sit on uneven surfaces like a soft couch or have a wallet on one side of your back pocket. Now that you know the common causes of piriformis syndrome, let's talk about the treatment strategy. So there's 3 steps to get rid of piriformis syndrome. I call this the RSS method. R stands for reduce stress, S stands for stretch, and the last S stands for strengthen. In order to reduce stress on a piriformis muscle, you have to pay attention to the triggers like we mentioned before, and do as little of that as much as possible. Then after that, we're going to massage the muscle to relax it. There are several ways you can do this. The easiest way is to take 1 or 2 fingers and find the tender spots in the butt area and move your fingers in up and down motion to relax the muscles. You can also use a foam roller to apply pressure to the same muscle for a more aggressive approach. And then if you really want to bring it up a notch, you cross your leg over while rubbing the piriformis muscle with the foam roller. If the foam roller doesn't work for you, you can always use a tennis ball to rub the piriformis muscle while you cross one leg over. Some of you might have a hard time getting into the position to use a tennis ball or foam roller, so you can also use a massage gun. The massage head that I like to use looks like a finger, and what you do is you find the tender spots on the piriformis muscle and just apply the massage gun for 1 to 2 minutes until the tender spots disappear. No matter which way you decide to massage the piriformis muscle, you have to check your symptoms during the massages to make sure that there's no increase in numbness or tingling down the back of your thigh. If you do feel numbness and tingling down the back of your thigh as you're massaging the piriformis muscle, you want to make sure that you dial it back because you're pressing way too hard. After a few minutes of massaging the piriformis muscle, you want to start stretching it. I'm going to show you 2 ways on how to do it. Let's say for our purpose, our right leg has the symptoms. The first stretch is on your back where you cross the right foot over the left knee. From here, you're going to pull the right knee towards the left shoulder while the right leg is completely relaxed. Once you feel a stretch in that right butt cheek, what you're going to do is you're going to press that left knee into the right hand. So essentially the forces are matching each other, and you're going to hold this for 10 seconds. If you do this correctly, you should feel the right butt cheek contract. After 10 seconds, you're going to try to pull that right knee towards the left shoulder to get more range of motion. And what you'll feel is that the tightness in the butt actually decreases. So you want to repeat this 10 seconds for 4 more rounds. Sometimes it's not convenient to be on your back, so I'm going to show you a chair version. Right leg has a symptom, so you're going to cross the right leg over the left knee and pull that right knee towards the left shoulder. You're going to feel a stretch in that right butt cheek, and when you do, you're going to push that right knee towards your hands and match the forces. Hold that for 10 seconds, and as you do that, you should feel the right butt cheek tighten up. After 10 seconds, what you're going to do is you're going to pull that right knee towards the left shoulder a little more. Make sure you don't pull too hard where you feel numbness or tingling down the back of that thigh. You want to repeat this for 4 rounds of 10 seconds. The next step in eliminating piriformis syndrome is to strengthen the muscles around it. And this is primarily the main reason why people get it in the first place. The first exercise is a butt activation exercise. You start off on your back with both knees bent, known as a hook lying position. Then what you're going to do is you're going to bend that right knee up. You're going to hold it with 2 hands. And with your hands, you're going to pull the knee towards you at the same time that your right leg is trying to kick out. So the forces are matching each other. So no body parts are really moving. You should feel your right butt cheek contract. You want to hold this for 10 seconds for 4 sets. You want to make sure as you're kicking out that leg that you don't kick out too hard where you feel any numbness or tingling. The second strengthening exercise for piriformis syndrome is a sideline clamshell hold. You lie on your side with both knees bent, stacked on top of each other, and then what you're going to do is round the pelvis and then shift the right leg forward until you feel a slight stretch on the left hip. Once you feel that stretch in the left hip, you're going to open up the right knee towards the ceiling. You're going to feel a sensation behind the butt cheek muscle. So if you're wearing a pant leg that has a line running through the side of your leg, you should feel a muscle right behind the line. That's how you know you're doing it correctly. You want to hold this position for 15 seconds for 4 rounds total. In order to keep your piriformis syndrome away, it is critical that you perform these exercises several times a week. Now that you know how to resolve your piriformis syndrome, comment below and let me know which of these work best for you. Also, if you found these videos helpful, please consider subscribing so you don't miss out on our weekly videos. As always, move better, age stronger, and I'll see you on the other side.